give us the abbreviation for RUBI?
Yep.
What
Yep.
is that? What does RUBI?
Yep, and I'll be honest, I forget sometimes, so I had to look it up again. Let's go ahead to the next slide. RUBI stands for Research Units in Behavioral Intervention, and it is a program that clinicians use to teach parents behavior management skills that are very, based in ABA skills. So that basically parents are learning the skills that ABA therapists know so that they can be implementing them in their home, in their day-to-day schedules with the child. So what we're going to talk about today is part of the program, part of the RUBI program. We're going to talk about kind of how it reviews basic behavioral principles, goes over some prevention strategies to try to prevent disruptive behavior, and the use of daily schedules. This is just one part of RUBI. This is part of a 4-part series that will happen in the next couple months, where the other sessions will cover the rest of the curriculum. So let's go ahead to the next slide. So, I have 2 grown children, and yet I still have these thoughts like daily, maybe that's just me, about, am I doing the right thing as a parent? I don't know. There's no exact model for every kid. And so I wanted to preface this talk with saying, and let's go ahead to the next slide, with saying, I am not here to give right or wrong parenting strategies. There are many ways to parent your kids, and nobody knows your kids better than you do. But this is really a talk about some well-researched, evidence-based strategies that you might find helpful in managing some of the struggles that can occur along with autism. I'm going to provide information about the strategies, basically so you all can think about what might be useful for you and your family. My standard disclaimer is today's session is not a therapy session, so please consult with a licensed professional to help implement the strategies, especially in really challenging situations. I'm hoping that by giving you the information, you can start thinking about what would be helpful in your family. So let's go ahead to the next slide. So this shows you a little picture of the manual that clinicians use. Clinicians use this to work one-on-one with families, with the thought being, who spends more time with a child than the parents? So why don't we give them the skills that the professionals know to help manage behavior? And again, there are a variety of skills. Again, we'll go through some of them today. And the goal is that you're building your toolkit so that you've got lots of different things to rely on to help manage disruptive behavior. Let's go ahead to the next slide. The goal of this program, PT stands for parent training. You already know how to be parents, but the goal is we're training parents in these skills, but we're trying to reduce challenging behaviors that might be impacting quality of life. So tantrums, aggression, trouble with transitions, daily routines, and also to increase adaptive skills, meaning what the child can do for themselves, appropriate behaviors. So that's the goal of the program. Let's go ahead to the next slide. There is an app that you will hear more about in sessions to come. It's called Attend Behavior, that is based on the content, and it's designed that families can kind of use it to kind of self-guide their implementation of these interventions. It's available to families on Apple or Android devices. I'm not going to talk too much about it. I have no financial disclosures or links with Attend Behavior or the RUBI program. But I do think it can be really helpful for parents as a way to try to kind of guide themselves through using these strategies. So let's go ahead to the next slide. So one of the foundations of the program is that all behaviors are learned. That does not mean we think any parent or teacher is teaching a child, to misbehave or hit someone or hit themselves. It just means that kids have learned certain behaviors work for them in certain situations. And so our goal is to break down if that's the case, how do we teach new behaviors? And it's based on something called the ABC model, that's going to help us understand why is a behavior happening, and thus what can we try to do about it. So let's go ahead to the next slide. So when you hear therapists talk about the ABC model, this is what it stands for. These are, I know, very technical terms, but antecedents are things that happen right before a behavior. You can also think of them as something like a trigger. B is the actual behavior that you're seeing. And C is a consequence that basically means something that happens immediately after the behavior. It might be a consequence that a parent says, oh, here's the consequence, but it also doesn't have to be. It can be anything that happens in response to the behavior. So let's go ahead to the next slide. And we use this model to help us think about what is the function of a behavior. So again, hearing more technical terms here, but basically kind of the why. Lots of parents ask me, I really don't know why they're doing this. And so thinking about this model and the functions of behavior can help us start to hypothesize. We can be wrong sometimes, but this is going to help us hypothesize and choose, hopefully, the most effective interventions. And one thing to remember is that behaviors are usually occurring because they're working in some way for the child, although it may not really be working for anyone else. So here are the 4 possible functions just to be thinking about. Kids can engage in behaviors to escape or avoid something they don't want to do. So this might be something like, I really don't want to do my homework. I really don't want to go take a shower. So that might be one reason you get a behavior. Second reason can be attention seeking, or even just getting a reaction. It doesn't necessarily have to be always positive attention. It can be any kind of reaction or attention from an adult. The third function is the child wants something, like I really wanted a cupcake right now, or I really wanted to play my video game right now. And then the fourth function to think about is that some behaviors are what we call automatically rewarding, meaning they just feel good. And so it can be really helpful to start to think about with your child, why do you think, which of these 4 things do you think might explain why they're engaging in certain behaviors? So let's go ahead to the next slide. Just to, again, get you a little more familiar with these terms. There we go. So again, just reviewing so you really have a good idea of what these mean. Escape means I'm trying to get away from something I don't want to do, or from people or places I'm not enjoying. Tangible means I want something. Toy, food, video, could be a lot of things. Attention means I'm doing this because of the reaction or attention that I'm getting. And automatic is I like the way that feels. It either produces like a positive kind of internal feeling or reduces a negative state. So let's go ahead to the next slide. So this slide is giving you a little preview from the Attend app, just so you can see what it might look like if you should decide that's something you want to use for your own kind of self-guided learning. And I'm using it to help kind of hopefully drive home what we just talked about, because it's a lot of technical terms, I know. But basically, here's an example where you think about an antecedent or a trigger. Ryan is given a turkey sandwich for lunch. Then the behavior that occurs is he falls to the floor and screams that he wants Pop-Tarts for lunch. The consequence then is that his mother takes the sandwich away and starts toasting some Pop-Tarts. So in this app, it'll give you the choice for you to choose, okay, what do I think the function or the why of this behavior was? And, my guess in this example would be, it would be to get what he wants because he wanted Pop-Tarts. So I would choose tangible. So let's go ahead to the next slide. One more example, Ryan's mother tells him to do his homework. The behavior is he runs away into his bedroom, and the consequence is his mother tells him, just stay up there because now you're being quiet. And again, you're trying to figure out, what do I think the function is? And I might say, probably escape, because it sounds like from the information I have, he didn't want to do his homework. And why is this important? Because it helps us choose which interventions might be most effective. So let's go ahead to the next slide. So this is an example of a data tracking sheet. And again, you can do this in any way that you want, but a lot of families have found it helpful to collect some data about behaviors using these types of terms we just talked about. This is a really complicated one. You don't have to do this, but basically tracking, okay, when behaviors happen, you know, where was I? What was going on? Who was involved? And then what was the antecedent? What happened before? What was the behavior? What did it look like? What was the consequence? What happened? How was the behavior handled? And what do I think the function was? The goal of trying to collect some data on this is you might start to see certain patterns with your kids. And again, that's going to lead us to, so where do we start? Which intervention should we be using? So this can be a really helpful tool for a lot of families. And again, you can collect the data in lots of different ways. It doesn't have to look like this. So let's go ahead to the next slide. So what I want to do is talk about intervening in that ABC model, those arrows, if you remember, before the behavior, at the antecedent side. What can we do to try to address those common antecedents that might trigger some of these behaviors? Because at least in my mind, it's way easier to prevent a big behavior problem than deal with it once it's happening. This program gives you 8 different categories. There is a lot there. I would not expect you to remember them all. I'm going to go through and highlight some of them, but the goal is to give you many categories, and you can implement them many different ways, so that again, you can find what's going to work best in my family and for my child. So let's go ahead and kind of dive into some of them. Let's go to the next slide. So the first category is you could decide, okay, if I found that certain behaviors are always triggered by certain situations, going to the store, or certain people, like, oh, when this neighbor kid's outside, things don't go well. So you could decide, well, then I'm going to avoid those situations or people until we get the behaviors more under control. I'm not saying this is going to, you know, always be an option, but it may help with certain situations. So the little graphic I put on there is meant to relay what a lot of families tell me, like, I cannot take my child to the grocery store on a weekend day when it's like super busy. And so you may decide, you know what, I'm just not going to do that for now, not until we get, you know, the behaviors better controlled. Maybe I'm going to go on a Monday morning, or maybe I'm, you know, going to have someone watch my child if that's possible while I go. So that's just one example of how you might say, I've noticed this is a common trigger. I'm going to reduce the overall level of distress by not doing that until we get some other things figured out. So let's go ahead to the next slide. Small doses is one of my favorite prevention strategies. And it basically means doing things in small amounts so that you can try to ensure the child's successful. A lot of families like this, if I talk about avoiding things, a lot of families will say, well, then that's not going to teach my child to ever be able to do it. And I'm like, that's true. So you might decide, I'm going to start doing it in very small increments. So one of the examples here, you know, if I'm going to take a road trip and I know my child cannot sit still in his booster seat, in his regular seat for 4 hours, I'm going to do it in small doses. I'm going to stop every couple hours, or we're going to break it up and stay somewhere. The grocery store example, you may decide, we're going to go in and get one thing. That might be doing something in a small dose. The baseball picture here, I don't know how many of you have kids that are in baseball, but when they're young, it's a long game and there's not a lot happening. And so a lot of families have told me, gee, when I take my child that was diagnosed with autism to these games, I've just learned, you know what, we can stay maybe an hour, and then I know things aren't going to go well. So we're only going to go for a short period of time. Or after 15 minutes, we're going to go take a walk and give him a break before things become a problem. So that's the idea of kind of doing things in small doses. It's basically, let's hopefully ensure that the child's going to be able to be successful with whatever it is that you're doing. Let's go ahead to the next slide. This is another prevention strategy I really like, which is change the order of events. And this is alluding to your daily routine or schedule. This is a graphic from that app, that phone app I was telling you about. So the example here is, oh, it's time to turn off your iPad and get ready for school. And the daughter's saying, I don't want to get ready for school, 10 more minutes. And so what she changed is she said, hey, go get dressed for school and then you can have time playing on your iPad. And the little girl's saying, okay, mom, hopefully it always goes this ideally. But our advice is often, can you save some of the more fun activities until you get through some of the kind of have-tos, like screen time after you get dressed for school, something like that. The family, Sasha, that I mentioned, they found this to be a very effective strategy. The way their schedule worked was they gave her a little bit of screen time after school to kind of decompress, but they didn't want her watching TV all night. But then it was really hard to transition off of screen time into the rest of their evening. And so the family decided that they really wanted to take advantage of, how focused she was on the TV while they made dinner. They're like, this is great because then I'm not worried that she's going to be fighting with her brother. So they put the screen time later in the day when homework was done, bath time was done, and they were making dinner. And that really decreased a lot of the behavior problems that they had been having in the evenings after school. Okay, let's go to the next slide. Another prevention strategy is thinking about how you ask. That's what we call it, change how you ask. So again, another little graphic from the app, again, just to give you previews. But here's a mom saying, what do you want for breakfast? And the child says, cookies. The mom says, nope, can't have cookies. And the child's yelling and hitting, I want cookies. So we would recommend maybe instead you give choices, like in this example. Do you want waffles or a bowl of cereal? So instead of saying, what do you want? And then having to potentially deal with them wanting something that you're not okay with, you give them choices. Sometimes we'll talk with families about giving the kids warnings. That can change how you ask. Like, hey, in 5 minutes, we're going to transition to this. Avoiding the word no. Sometimes no is a very common trigger for a lot of kids. And in the family I was mentioning with Sasha, changing how you ask, giving choices was very helpful. Again, this was a little girl that was pretty smart, and she seemed to like to still have some degree of control over what she was doing, and giving her a couple choices seemed to really meet that need. Okay, let's go ahead to the next slide. Respond to early signs of the problem. This is another prevention strategy. Basically, it's, can we redirect, distract before Hulk mode starts? Now, some parents will tell me, like, there is no escalation. My child goes from 0 to 100 like that. And that does happen sometimes. But some families can tell me, no, I can see them, their body getting agitated. I can see the veins in their neck kind of popping out, or their faces getting red. So if you can see my child's getting really agitated, I think we're going to have some disruptive behavior soon. The goal is, can you respond right then? Let's redirect, let's distract, let's change what we're doing. It's not the same as if you want to use the words giving in, saying, okay, you don't have to eat dinner, you don't have to take a bath. It's saying, let's change what we're doing right now before this escalates. So let's go ahead to the next slide. Visuals, one of you mentioned, and visuals can happen in many different ways. I have found a lot of families find these first then boards very helpful, where you're showing the kids a picture of, first, here's what I want you to do. So in these examples, first, homework, first brushing teeth, and then the fun thing, the video game, reading a book with mom. For a lot of kids, seeing it right there together, like, here's the thing that feels a little overwhelming, but right after is this thing that's super fun and I'm going to enjoy, can be a really useful way to kind of help get them through some of those things. All right, let's go to the next slide. Timers, use of timers can be really helpful. I have just noticed with many children that there's something about a timer going off versus mom or dad saying, you have to stop now, it's time to move on. Sometimes it just feels a little less like emotional. And so I've had families use things like Alexa to set a timer. Could be a kitchen timer, a timer, phone timer, whatever. And you let the child know, like in 2 minutes, we're going to turn the TV off and go take a bath. I've had kids, pretty young kids, learn to be so like dependent on that when the parents forget they set the timer, I've had a kid that would give his parents iPads and say bath time. Like he just got really used to the predictability of the timer going off and what that meant. I put a Fitbit on there because I recently had a parent say that at the child's school, they were using them so that a timer would go off, meaning the Fitbit would buzz. Nobody heard it, but that was the cue for the child that it was time to get ready to move on to the next activity. And it was an older child. It was really nice. It was non-intrusive. And I thought that was a great idea. Okay, let's go on to the next slide. Schedules offer another opportunity to use prevention strategies by looking at kind of all day. What does your daily schedule look like? And then figuring out where are we having some particularly challenging behaviors and where can I use some prevention strategies in here? So you might decide, again, change the order of events, do bath time at night instead of the morning. You might decide, wow, we don't really have a schedule. Maybe we would do well with a more predictable routine. That might help. A lot of individuals with autism tend to like some predictable routines, not all, but you might create like a schedule for here's what we do for bedtime. Here's what our morning routine is. And sometimes that can help decrease disruptive behaviors. Let's go ahead to the next slide. Here's an example. I'm sure many of you know what visual schedules look like. There are many ways to do them. So just wanted to show you a couple pictures with little icons. Again, lots of ways to do these. Let's go ahead to the next slide. I know I'm running a little short on time. I do want to show you this video of how to use a daily schedule that's from the app, just to give you an overview. So if you guys can hit play for me, that would be great.
Okay, you're all done brushing your teeth. Put it in the bag. Very good. Now what do we have to do? Put on coat, okay? So let's go. Take it. All right, let's go put on your coat. Come on, let's go. Good, you put on your coat. Let's put that in the bag. All right, what's next? Put on backpack. Okay, let's go. Come on, let's go put it on.
Okay, let's go to the next slide. The other thing that can be helpful about having kind of a predictable, consistent daily schedule is it just kind of keeps things consistent between all caregivers and can help communicate, if you have babysitters, grandparents involved, this is the way things go, and this is how, my child seems to respond well. So let's go ahead to the next slide. A behavior support plan, when I'm doing this with families, doing the actual RUBI curriculum, we have a pretty long written document where we are keeping track of every strategy that we have found work well for this child. And so I often encourage parents, as you are trying some of these strategies or any strategy you're trying that works, write it down. You can then share it with teachers, you can share it with other relatives. And if you find that, oh, we haven't had this problem in like 6 months or a year, what did we use back then? You can always refer back to it. So let's go ahead to the next slide. Let's go ahead, one more. Okay, so almost done here. I just thought this, again, was a little comic relief and thought, wow, I would have loved some kind of contract. But it's a reminder that every child is unique and it's your first time as raising this particular child. And so if we go on to the next slide, my big reminder is to just know that we're all doing the best we can. Keep up the good work. So let's go ahead to the next slide. All right, I think I'm passing this on, correct?
Yeah, this is me, Barb. Thank you. That was really great. So I'm Will Lever. I'm a psychologist at Nationwide Children's. And I know a lot of you guys have mentioned in the chat and other things like this that there are a lot of barriers to getting this type of care. So one of the problems is this is a pretty complex treatment. And a lot of times the things that are needed for it is the background and how to deliver this type of service. There's also a lot of stigma around getting care. And then there's also just not a lot of specialists, especially for some of you around the world who are tuning in today. So one of the things, we can move on to the next slide, that we're working on, that we're trying to get out there, is ways to increase access to these types of services. So we're trying to simplify the treatment. We're trying to give it to you all directly. We're also trying to harness this digital technology and use that as well. So coming up in later trainings, we'll talk more about the Attend Behavior app that people have been mentioning in the chat, but we'll also have other options as well. And then there's the most important part, which is changing the mindset about how we think about delivering behavioral interventions. So these complex treatments like RUBI really do need some specialist services, but a lot of the strategies, the simple things that can be done at home, can be delivered by people who don't have a special degree. So a lot of this stuff that we're trying to talk about and train on today can be done with the help of your team, but also done by you guys with the help of an app or other services like the trainings we're provided. And that's called task sharing, where we actually take some of the services that we typically do in treatment and give it to people who can do it directly with kids who need that help. So as we're going through this, I want to keep that mindset in place. We're not talking about getting rid of teams or anything like that, but a lot of this stuff, especially some of the simple behavior skills, can be done directly. So I just want to keep that mindset going forward. Thank you, guys. We can go to the next slide.
Thanks, Will. And I think that what I would add to that on this slide is just, again, that's why we love the fact that you're here to participate and learn. And I think by doing that, you're going to be able to share back with your teams, whoever that is. It could be within your own family, that could be your professional team with your doctors and your therapy people as well. But that's one of the things that we really want to encourage you to do, is as you learn the information in this series, is to really, get active with it and then to share it back. Next slide. The other thing too is, again, I just want to make sure that you recognize how powerful your leadership is in doing this kind of work with your child. And here's again just some things to think about as you go into next steps, where you're starting to look forward into more maybe care and treatment pathways, but to write things down and really sort of think about what is the information and the expectation you have when you're in appointments and working with a therapist, and to discuss those behavioral approaches that are working and making sure that everybody across your team has that, so that there's a lot of consistency and effectiveness. And again, you're going to have access to all this information. So if you didn't catch anything on here, don't worry. We're going to be sending it out to you. Next slide is resources. We're going to compile these and get these out to you so you have them, so you have more information on a lot of the things that we talked about today. And then I just want to do one more slide. Again, we just always have to do a quick thank you to the people who fund us. Autism Care Network was funded this series for a very long time, and they continue to do so. And then the Ohio Department of Developmental Disabilities is actually helping to fund this. And if you are an Ohio family and you want to find out more about RUBI within your county, we're going to drop a link into the chat, and we'll see if we can get you connected to someone in your county who is maybe a RUBI provider who is learning RUBI at this time. All right, and I think we're at questions now, so you can go to the next slide.